My name is Will DeFoor. I'm a PA with rheumatology at Coronado Clinic as part of Duke Health. I see adults aged 18 through end of life, and I see them for a wide variety of conditions, but generally you can think of them as autoimmune conditions and other musculoskeletal conditions. Conditions that I treat would include things like rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, lupus, other forms of mixed connective tissue disease, or other systemic connective tissue diseases. My general care philosophy is I like to make sure that I treat my patients the way I would want my own family or loved ones to be treated, so I like to be thorough. I like to make sure that I'm explaining the care that they're receiving and making them not just a passenger, but an active participant in their care, and trying to make sure that anytime I consider a medication or a diagnostic, that I'm considering would I recommend this same thing for my family in the same situation? And if the answer is yes, that's when I actually try and do it in practice. I think one of the strengths of Coronado Clinic is how dedicated they are to the care of their local community, trying to make sure that anybody that needs care should get care, but particularly trying to make sure that the interests of their local community, being a part of the community, are being cared for, since they're such a community-based clinic. My favorite thing in the job is probably when I see a patient come into me and they've been dealing with pain or other types of suffering for a really long time, and our whole first visit, there's not a smile on their face, and after a few more visits, they've got a smile on their face.